The Gastroenterology Association of Australia has released new guidelines for the assessment and management of idiopathic gastroparesis. When talking about disease, the word idiopathic means any disease with an unknown cause. To hear a more detailed explanation of the new Australian guidelines, you can check out Paralysed Guts or Claire Avery. I'm going to be talking more about the consequences of guidelines like these and why you need to pay more attention to them even if you don't think this impacts you. Ehlers-Danlos syndrome was thought to be rare, and certainly some subtypes are particularly rare. The vascular subtype impacts about 1 in 100,000 people, the classical subtype about 1 in 20 to 1 in 40,000 people, and other subtypes impacting 1 in a million people. The hypermobile subtype has been underestimated, and as of 2017 is recognised to impact about 1 in 600 to 1 in 900 people, making the overall prevalence of Ehlers-Danlos syndromes about 1 in 3,000 to 1 in 5,000. EDS is a connective tissue disorder, and connective tissue is what makes up nearly all of the structures in our bodies. Our relationship with gravity is also relevant, as organ sagging in EDS patients is often worse when seated, upright, or standing. This means gastrointestinal issues are common in this demographic because of the change in physical location of your gastrointestinal organs. What does this have to do with the new guidelines for idiopathic gastroparesis? A lot of healthcare professionals are unaware of how EDS impacts gastric function and still believe it to be a rare disease that only impacts joint mobility. But EDS can impact the function of all of the body's organs: the brain, heart, kidneys, gastrointestinal system, liver, and more. Statement 8 of the new guidelines specifically discourages assessment of vascular compressions, hypermobility disorders, mast cell activation syndrome, autonomic dysfunction, and microbial dysbiosis. The guidelines make this recommendation strongly, even though there is a low quality of evidence to support it, and we know Ehlers-Danlos syndrome is underdiagnosed. Patients who fall into these brackets of diagnoses, even with pre-existing diagnoses of EDS or other hypermobility, with severe gastric dysfunction and gastroparesis as known complication, are still receiving diagnoses of idiopathic gastroparesis alongside diagnoses of eating disorders, with the eating disorder being attributed to the cause of the weight loss or changed in behaviour around food. This has disturbing results. Patients whose gastric systems do not work properly and who are malnourished as a result are denied access to appropriate refeeding in favour of psychological interventions like cognitive behaviour therapy and hypnotherapy, and when those fail, are forced under the Mental Health Act for an eating disorder they either never had or that only developed because of the interplays of their underlying disease combined with trauma and diet culture. The outcome here is exceptionally violent. This results in patients dismissing their underlying medical cause in favour of labelling their symptoms as anxiety, depression, or trauma, which results in serious misinterpretation of symptoms or death from starvation or other medical complications of starvation. When we are unable to correctly recognise the cause of our symptoms, we are unable to respond appropriately in medical emergencies. Adding to this, if you have a diagnosis of an eating disorder already on your file, then your symptoms are more likely to be automatically attributed to an eating disorder instead of an underlying medical cause. Statement 8 likely won't result in a huge change to service provision as it stands, because Statement 8 has been the practice standard for years already. Patients with these specific diagnoses and recognised conditions are already being told that they either don't have these conditions at all or that they aren't the cause of their symptoms, even though the evidence base tells us that those conditions cause those symptoms. They are denied access to appropriate medical care, walking away with diagnoses of eating disorders. I want to be very clear here. If you have the conditions listed in Statement 8, then your gastroparesis is not idiopathic. It has a known cause, and you need to fight for it to be recognised. If this is something that has impacted you, then there are 2 things that you can do. 1, fill in the community response to the GESA position statement on the assessment and management of idiopathic gastroparesis. And 2, sign petition 4521-26, independent investigation into forced feeding practices. The links to both of these will be in the description of this video, and in the comments alongside the GESA guidelines and a link to an Ehlers-Danlos syndrome resource so that you can learn more. Thanks.